We are back on MorningLine. Thanks for joining us. Let's get to these phone calls and see if we can help them. The number you see, 737-7587. Clint Kelly, our malpractice attorney, and let's go to Joni. Hi, Joni.
Hello, Nick. How are you?
Good. How can we help you?
I just got through saying I didn't have a malpractice suit on someone's back chiropractor. I have been going to IMS for thyroid problems that my 4.5-year doctor for my thyroid, all the medications didn't work. So I'm going to Innovative Medical Solutions to find out about my thyroid. Well, all they do there, I got to look in on the board, and all they do is chiropractic. It's nothing that they have not mentioned. I've been 5 times and they have not mentioned anything about my thyroid except that my thyroid is completely shut down. The first visit, they give me a blood test and told me that my immune system is what caused my thyroid to quit. The second time I went there, they give me a chiropractic treatment that I did not know nothing about. They took me in there and told me to sit in this chair that wobbles, and he didn't tell me that. When I sit down, I've already had my back a spinal stimulator put in, which took 8 years to get that put in. You know, through all the shots and everything you had to go through to get that. Well, when I sit down, I fell backwards, hit my hind end on the balls of that chair, and my head against the wall. I have got pictures the night that I come home that very day. My whole left cheek is solid black.
Okay, and this is because you fell off the chair. That was, you think, how long ago did...
Office, and he did not offer to pick me up. He didn't tell me the chair wobbles, the arms wobble, the bottom wobble. He just said, you sit here and I'm going to sit here.
How long ago was this?
This was 3 weeks ago.
All right, Clint. Now, at first I thought she was going someplace else, but now it sounds like she was discussing an issue where there was apparently a faulty piece of equipment that she sat on and hurt herself. What do you think?
Well, I want to begin with something else that she raised. Do you know what a bait and switch is?
Well, yeah, I mean...
You bring somebody in for treatment A, and they get them into treatment B.
Okay.
And it sounded like what she was saying was she went to this chiropractor for thyroid treatment, or was going to get evaluated, and she gets sort of induced into chiropractic treatment.
But, wouldn't you think you're going to a chiropractor for an alternative medicine, as she said, and that part of a chiropractor's treatment, if he believes or she believes it helps her condition, is chiropractic?
She may have thought, again, and we're speculating, but she may have thought this place provided treatment for thyroid, that's Innovative Medical Solution. Do you see what I mean?
Yeah, sure.
She thinks she's going for one thing. Again, I'm speculating. I don't know this for a fact, but she's going for one thing, but she's getting treated for another. And she's like, well, this isn't what I signed up for. I signed up for treatment A, and you're trying to induce me into treatment B. And, again, what you and I were talking about earlier, I think you're going to see more of this occurring. Now, whether patients get a serious injury from this, that's a whole different matter. But I think you're going to see situations where people go for these treatments they think they're getting from someone they think's qualified, and it turns out not to be true.
Okay.
That's all I'm saying.
Well, you look into it, and but a lot of people turn to alternative medicines that end up working.
And nobody should have to sit in a rickety chair and fall down at a doctor's office.
Well, let's go to Joseph. Hi, Joseph.
Good morning.
Good morning, Joe. What's on your mind?
I had a situation where I went to a dentist, and he x-rayed my teeth and told me I had a broken tooth down the jawbone on the left side. He proceeded to do some type of a filling on the left side and another tooth, and it completely ignored the right side tooth that I was complaining about and didn't fill the cavity.
Wait, so they worked on the wrong tooth?
Well, he said I had left and right side problems, but he worked on the left side, and I asked him to work on the right side.
All right. This gets to a point.
Toothache on the right side now.
Okay.
Yeah, this gets to the point that it's a real blurry line where Joseph is, because on the one hand, Joseph is authorizing the dentist to perform a procedure in the mouth, but on the other hand, Joseph is expecting that the doctor's going to work on one side as opposed to the other. And the question in these cases always is, was proper authorization given for the procedure? And it sounds like what Joseph's saying is, I really didn't authorize the filling on the other tooth. He told me I had an issue, but this isn't really what I wanted. I really wanted treatment for the broken tooth. Real fuzzy line. And what I tell patients in these situations, or people who call me, is, you know, in a fuzzy case like that, I generally can't take them, because what's going to happen is the doctor's going to say, look, I had authority to go into the mouth, and I had authority to work in a particular area because the patient had a problem. And then you get into the swearing contest between the patient and the doctor.
What he said and what the doctor, yeah.
And it's almost always a loser. In the case like with the mother whose child was operated on, there's no defense to that.
Right.
There's no signed consent. There's no way in the world you could ever argue that I'm allowed to go into a child's mouth without permission, or working on the wrong elbow. I mean, but when you're in the mouth with a dentist, small area like that, it's really hard to say I didn't give authority for that procedure.
Do you ever have cases where you're suing dentists? Does that happen?
Yes, I had. I had one. It was many years ago, but it was a different situation, where a dentist prescribed large amount of pain medication to a woman he'd extracted wisdom teeth from. She was already taking Xanax, and 2 days later she died from an overdose. And the issue in that case was whether she should have ever been prescribed those narcotics when she was taking Xanax.
Should he have known that, or is that standard?
Yeah.
A doctor should ask, are you taking anything else?
Well, it was even worse than that. The pharmacy was in the case as well. The pharmacy was a defendant. The pharmacy was arguing that the dentist should have known that you don't prescribe these two together. I mean, there's actually an alert system in the pharmacy computer that says if you prescribe Meprogan, which you really don't get much more, that's Demerol, and mix it with Xanax in large quantities, you can put somebody to sleep for good. It's like putting a dog to sleep.
So yeah, they need to be aware. It's not the patient's responsibility to say, by the way, I'm taking this. They should be asked that.
Oh yeah, I mean, he knew what she was taking.
Okay,
Yeah.
All right. I'm just wondering, as we kind of wrap things up, just if you're sick, do you go to the hospital?
I'm only going to go to the hospital if I'm really, really sick. And I'm not saying, I don't ever try to argue to anybody you shouldn't go to the hospital. I mean, that's crazy. I mean, if you got to go, you got to go. I'm just saying that you and I have discussed this before, that we have a real serious problem in this country with people getting infections in hospitals.
Right. And now, is that something that's you can litigate?
You can. A lot of it depends on whether or not the infection was properly diagnosed and treated. It's not necessarily negligence for someone to get an infection in a hospital.
Right.
But what can be negligence is if the physician sees that the patient's having fever, nausea, chills, and lets the patient go home when they're showing signs of an infection, and then when the patient comes back, the patient dies or succumbs to the infection to some extent, and the doctor's alleged to have misdiagnosed the infection.
That's the key. That's the key. Just getting an infection. I just think back to Tom Brady, the quarterback for the Patriots years ago, had his knee torn up and had to go have surgery. And I just remember his delayed return because he developed an infection in his leg. Now, I think we all expect and hope we get the best care. I can tell you, Tom Brady had the best surgeons, the best hospital, the best of everything, and he still got an infection in his knee, which they addressed and treated, but there was never any claim of, oh, well, they messed it up because he got an infection. I mean, even in the very best of circumstances, he's going to get the very best care because of who he is and the money and the team paying for it. He's still got an infection.
Well, you can get an infection simply because, when they go into the body through surgery, all the instruments can be clean, but some part of the bacteria can get inside of the operative field and someone can get sick. Again, that happens, no negligence on the part of the healthcare provider, but when you've got signs and symptoms suggestive of an infection and you let somebody go home, you have to be held accountable for that.
I understand that. If you see the redness or pus or whatever, that's something like that.
Exactly.
And do you believe that most of the equipment used is always going to be very clean?
Well, no, you and I talked about that off camera. That's for another show.
But sometimes, there's autoclaves. There's things we have tests. The needles are all not reusable. They're all disposable.
Right. But again, there are instruments that are being used today that people are getting sick from, and we'll talk about that.
Yeah, we'll talk about that. That's something to tune in for next time. Just real quick, I always like to wrap this up. You also handle sometimes class action cases.
Correct.
With regard to
pharmaceuticals, bad drugs. We have cases involving patients who got injured from Xarelto and bleeding disorders, and also patients who had a IUD that's come loose. It's called a Marina IUD.
Yeah, we did a story on that. I was wondering if you mentioned that, where there were a lot of women that maybe had an adverse reaction to whatever happened on that.
Correct.
And when that happens, you get together as many clients as possible.
That's right. And then we have a number of other attorneys that work with us in those cases, and they're usually centralized in a federal court, and that's how they're managed. They're called mass torts.
Let's put your contact number up. Is that all right? I think we got your home phone number today, too. No, just kidding. Take a look there. It is. All right. As we said, Clint Kelly Firm is there in East Main Street, Hendersonville. The number is 615-824-3703, 824-3703. And the thing to remember on this, if you're wondering, you didn't call in this morning because you're busy making coffee, you're heading out to work, but you think you might have something that could be a case, 824-3703. It costs you nothing to call, and Clint will be brutally honest with you about whether or not you have a case. And if you do, at least you got it underneath the statute of limitations. If you don't, you tell them, right?
Absolutely.
You can't. And if they're not satisfied, they can go to another attorney to see if the case is. But you see them all, and you'll be honest.
It costs nothing, Nick. It's free.
Okay. And yeah, that's the point. Clint, as always.
Good to see you, Nick.
A pleasure having you come on. We'll see you again in the not too distant future. I can talk to you about a bunch of stuff. It's interesting. With you and the cases you handle, I wonder how you even seek medical attention when you need. But the fact is, we all have, and we're all still here alive, but sometimes there are bad things that happen.
Just got to be a cautious consumer.
Cautious consumer. Thanks again, Clint. We'll take a break. Be back. Programming note right after this. Stay with us.